Healthy Alternatives to Vaccinations is so pleased and excited to present two wonderful people. Dr. Paul Thomas and Dr. Jennifer Margulis are co-authors of the book, The Vaccine-Friendly Plan, Dr. Paul's Safe and Effective Approach to Immunity and Health from Pregnancy through your child's teen years. Dr. Paul is a pediatrician and practices in Portland, Oregon, and is now on a mission to educate the public on the issues of toxins in the environment and on vaccines, or in vaccines. Dr. Margulis is a former senior fellow at Brandeis University and is a Fulbright awardee and is an award-winning science journalist and book author. So thank you for joining me today, and I'm looking forward to your presentation.
Thanks for having us on.
Thanks for having us, Nancy. I'm going to go ahead and start the slides, and hopefully this is going to work. So bear with us for just a minute. Uh-oh. We had this all set up a minute ago. Sorry, everyone. Hold on.
So while my amazing co-author is finding those slides, I got to tell you that as a pediatrician and an avid blog writer, I was not an author. Ah, there we go. So I stumbled on this amazing author, Dr. Margulis. Take it away.
All right. Let me just see if I can play this from the start. Okay. When you have a baby for the first time, I think it's an incredible experience, and you meet someone that you've never met before, but somehow you've known for your whole life. And that's how I felt when I met my first daughter, and this is a picture of her. Can everybody see the pictures? Yes.
I'm seeing the slide of the book cover.
Uh-oh, so it's not playing.
Just arrow down, see if it'll move that way.
Hold on. So I have it on.
There you go.
Now you can see it? Oh, okay, hold on. So let's start again. Nancy, okay. So now you can see the first slide?
Now we're in a water birth slide.
Okay, so let me start again. This is a picture of a joyous, amazing, incredible birth. This was not my experience with my first child, but I do think that when you have a child, it transforms your life, and you meet somebody that you've never met before, but somehow you've known for your whole life. That's how I felt when I met my first child. She was born at Emory University at Crawford Lawn Hospital, and I had a very difficult labor and delivery. It lasted about 22 hours. I had wanted to have a natural birth, and I ended up getting a lot of medication and feeling just really exhausted, but completely delighted to hold this baby in my arms. And a nurse came into the delivery room just after my daughter was born, and she said, "It's time for your hepatitis B vaccine." And I was really taken aback. My mama bear instincts kind of kicked in. I was a very educated young adult, and I knew that I was hepatitis B negative because both my husband and I had been tested, and I had received excellent prenatal care, and I knew that hepatitis B was a sexually transmitted disease. I knew, and I later confirmed through the CDC, that hepatitis B is mainly spread through sexual contact, sharing needles, and contaminated blood. And I told the nurse that I felt a little uncomfortable and that I wanted to talk to my pediatrician. I since found out, and this is all information that you can get from the Centers for Disease Control and Prevention, that hepatitis B virus is not spread through food or water, eating utensils, breastfeeding, hugging, kissing, hand-holding, coughing, or sneezing. So the idea that I would need to give this baby who had come out into the world, into a world of so much love but had difficulty getting there, a hepatitis B vaccine felt a little counterintuitive to me. And when I told the nurse I just wanted to wait and talk to my pediatrician, she got very upset and angry with me. And I still remember, when you're a new mom, you have a lot of strong feelings, and I still remember that feeling of her being angry. And 2 weeks later, my husband and I took the baby to the pediatrician, and we said, we feel really worried. We feel like we really need to give her this vaccine, or we're just not really sure what to do. And the context that that's coming from is that I had all of my childhood vaccinations. I had lived and worked in West Africa when I was in my early 20s, and I had seen firsthand, survivors of polio and measles in a country where people don't have access to good food and drinking water. And I had a really healthy sort of respect and almost love for vaccines. And the pediatrician literally sort of tossed out over her shoulder, and she said, "Oh, I'm so glad you didn't do that. That vaccine's been counterindicated in newborns." And that actually wasn't true. What had happened was that in 1999, when my oldest daughter was born, the CDC came to realize that they had been adding childhood vaccines to the schedule without ever looking at what happened to the schedule as a whole. And they hadn't realized that so many of these vaccines at that time contained thimerosal, which is a mercury-based preservative, that when you counted up the cumulative total of mercury that we were exposing kids to, it turns out to be, and we talk about this in our book, 125 times safer, 125 times the safe limit of the EPA guidelines and 42 times the safety margin of the CDC and 31 times of the FDA. So any government body that you looked at that was counting up mercury toxicity, by the time a baby was 2 months old, they were getting too much. So the CDC at that time, it was just July 1999, had actually asked pediatricians to suspend the birth dose of the hepatitis B vaccine. Since then, they have they've put the hepatitis B vaccine back on the schedule, but that started for me a question of looking at the vaccines and realizing that it wasn't wrong of us to go against the nurse's recommendation, but that it was actually really smart. And my husband and I had a very long sort of soul-searching conversation about what would have happened if we had said yes, and then we had gone to the pediatrician 2 weeks later and she had said this is counterindicated. So we did eventually, we did choose to vaccinate our children. I have 4 kids, but we did it in a different way than most people, and we were very careful, and we looked at each disease and our risk factors for our family, which ended up being very different from other people's families. So my children have had a vaccine against yellow fever. Nobody listening on this call or who watches this webinar later probably, besides Paul, has had that yellow fever vaccine. That's a vaccine I've had several times. But there were other vaccines like the hepatitis B vaccine that we chose not to do because we realized that the vaccine didn't make sense for our family. So on February 18th of 2015, which was my husband's birthday, which is why I remember the day, I went up to Salem with a friend to testify in front of the Oregon Senate Health Committee. I went to testify against SB 442. SB 442 was a proposed bill to take away any freedom of choice like we had done in our family. What the legislators were saying is that we should require all vaccines for all children, and if they don't get them, they will not be allowed to go to public school in Oregon, they will not be allowed to go to private school, and they will not be allowed to go to daycare. And although I am in favor of really good education, and I believe that it's very important to help people make really good decisions by educating them, I do not believe that we should live in a country where medical decisions are one size fits all, or where we have coerced medicine. And it felt so important to me that I asked my husband if he would stay home and take care of our 4 children and let me go and testify. So as you can imagine, that was a tense situation. There were hundreds of people in that room, and everybody's blood pressure was up to their eyeballs. I know mine was. My hands were sweating. I felt very nervous. I was listening to everybody talk on both sides of this argument, and there was one person in that room who made so much sense. This was a man with boundless energy who took a packet of information 1 inch thick and handed it to each of the senators that I hope you can see in this slide, and stood up in front of all these people with a hand in his pocket. He was a man with a round face and a sort of boyish good looks, and he stood up with his hand in his pocket and he said, I am a pediatrician. I have over 11,000 children in my private practice in Portland, and I want to tell you what I'm doing and what I'm seeing in my practice. And that was how Dr. Paul Thomas and I met, because I had no idea, even though I had interviewed hundreds of doctors for books that I had written in the past, and I was very interested in talking to pediatricians and healthcare workers of all stars and stripes. I had never come across this guy before. So I tracked him down so that I could find out more about him. And he was there, and I'm gonna talking about why he disagreed also with SB 442 as a practicing pediatrician. So that meeting was, this book that we wrote together was basically the result of that meeting. And I'm going to turn things over now to Dr. Paul.
Well, thanks, Jennifer. That was a fortuitous day for this book and hopefully the world and children of the world who are being unnecessarily harmed by toxins. And after I testified, so I closed my practice. I like Jennifer, felt very strongly that people need informed consent. It is wrong to mandate medical procedures without any consideration of a person's risk factors, their family history, their personal beliefs. In any other condition or procedure, whether it's surgery or any medical procedure, we always use informed consent, which means you're given the pros, the cons, the alternatives, and when it comes to vaccines or any procedure, one of the alternatives must be not doing the procedure. And of course, this bill was going to get rid of all options for parents. It was one size fits all. That would have just destroyed my practice. I left my group practice in 2008 and started my own practice, Integrative Pediatrics, and I'll share more about that experience in a minute, but I want to take you back to my childhood. I grew up in Africa. I grew up in Zimbabwe, used to be called Rhodesia, and there you may be seeing a picture of my family. We had a blended family in the sense that the African family you can see there were like my other parents. My mom was busy in a clinic. People would be bussed in for 50 miles as a registered nurse. She was delivering babies, doing minor surgeries. I mean, she was amazing. And my dad was off traveling the country, and so this African family helped raise me. The village we grew up in, this picture was taken later, you can see we're pretty dressed up, but we started off in a village, a classic African village with round thatched roof huts. You can see
Excuse me, I'm sorry, Paul, but Dr.
Yes.
Paul, they can't see these slides because they're on Jennifer's screen.
Oh, okay.
Right, so
I'll just talk.
Well, the other thing is if she says something for a second, it will pop up on the screen.
Oh.
So if I go, this is Jennifer, if I go back then, can people see our slides?
Yeah, I don't know why it's not popping up now. It should.
So they're not popping up?
Okay, there it is. Do you see it?
Do you see them? It's funny because why can Paul can see them, but they can't. Huh?
Right, because we can see each other's faces on the bottom in our screen.
Gotcha.
Oh, yeah. I see.
Okay, right. So Jennifer, you'll pop in at each slide.
Okay, so this one is the slide of Dr. Paul is the young man on the right-hand side. Nancy, Can you see that? People can see that.
Yes.
Yeah.
Okay, so there I was in a checkered shirt, and the little boy standing in front there, you're going to hear about him in a minute. That's Taurai. So in the village, our house had no running water, no electricity. We went to a school that had a blackboard and brick benches. There were no desks, no chairs, no papers, no pencils. We did our math in the sand. You would draw a couple lines, easy to erase your mistakes. It was a very simple life. Our kitchen was a thatched round hut, and our bathroom, if you will call it that, was a hole in the ground, a pit latrine. And that was where I grew up my first 3 or 4 years of life. Very simple, learning the African language. You can see me here playing with my friends. My sister and I were the only white kids in the village.
Wait, I'm just going to interrupt you because if I talk, then they can see you. So here's Dr. Paul.
Yeah, I actually have it set up where I'm moderating, so I don't worry about it. I have it taken care of.
Oh, okay. So now they can see it?
Yes.
Okay. Sorry
Okay,
for anyone who's listening in.
No worries. So in the village life, I saw more deaths, went to more funerals in my time in Africa than I think most people will have in a lifetime here in the United States, even doctors. Africans die young. There were, numerous reasons for this. One death in particular that really hit me hard was that of that little boy that was standing in that first picture. His name was Taurai, and he was like a brother to me. He was quite a bit younger than I was, but we played a lot together. I would come home from school and we'd play in the dirt, and I was trying to teach him how to ride a bicycle. At a time when I got home from school one day, and my mom said, Taurai's in the hospital. I really didn't know what a hospital was at that point. I'd never been to a hospital. But the next day when I came home, my mom said, Taurai died. And, I didn't know what to make of that either, except it hit me pretty hard. At first I was just numb. My mom asked me, would you ride your bike over to Mrs. Johnson's house and let her know Taurai passed away? Okay, Mom. So I hopped on my bike and I rode through the woods to her house, knocked on the door. And when she opened the door, I just burst into tears. I couldn't even choke it out. She, I guess, knew he was in the hospital, so she was able to help me choke out the fact that Taurai had died. I later learned he had died of measles. And I've often wondered since, had he gotten a measles vaccine, might he have been spared? Who knows? I had measles as a child, and most of my playmates had measles, and they were fine. We now know that with good nutrition, measles is rarely fatal. It's actually quite a survivable disease. But that certainly set the stage as I went on through my career. So fast forward to Dartmouth Medical School, where I went to medical school in Hanover, New Hampshire. I did not see a single case of autism, but I learned about the value of vaccines. So, we learned about smallpox being eradicated, polio, and of course we could go into that discussion. There's complex issues involved with sanitation and definition of disease. But, we were taught the value and the power of vaccines. Fast forward to residency. So I was in medical school 1981 to 1985, residency from 85 to 88. And at that time in California, in Fresno, California, and then San Diego, California, we introduced the Hib vaccine, Haemophilus influenza type B. I saw the decrease in meningitis. I mean, you could feel it. So as an intern and a resident, we had to do lumbar punctures. And that's where you stick the spinal needle between the vertebral bodies and the lower back and pull off a little bit of spinal fluid. And I was doing 3 to 6 of those a night for kids who were so sick they probably had meningitis, and that was how we figured that out. And that rate dropped in half, at least in the area I was learning and training, after the introduction of that vaccine. So I was convinced vaccines were a powerful tool for a pediatrician. So that's how I started my career in pediatrics. And, charge off to Portland, Oregon, where I worked at Emmanuel Children's Hospital, teaching residents and medical students, and, basically doing what I could, following CDC guidelines, Academy of Pediatric guidelines, trying to do the best I could do to keep children healthy. Now, what happened was, as I went into private practice, starting in 1993, and very much progressing into the 2000s, something was very wrong. Children were not as healthy as they used to be. We were starting to see much more autism as just one canary in the coal mine, as I like to call it, because diseases, chronic diseases in children are plentiful these days. It's not just autism. There's ADD, ADHD, anxiety, depression, all the autoimmune things like diabetes is on the rise. All the allergy things, asthma, eczema, we are seeing an epidemic, in a sense, of all these chronic diseases. And in the standard literature I'm reading as a pediatrician and being fed by the system, it was sort of, we don't know what's going on. And I'm going, this is not okay. How can a pediatrician, we're the ones who are supposed to know the most about children's diseases and how to take care of them, not know what's going on? It just... I just couldn't do it anymore. So I'm going to tell you a story that was sort of the straw that broke the camel's back. It's a story about Jack. That's not his real name. But it was November 2007. And I walked into an exam room to what I thought was going to be a normal, well, 2-year-old visit. I opened the door, knock, knock, how are you doing? And across from me was the window, the light shining in across Jack, and he was sitting in a stroller with his head going back and forth and back and forth and back and forth. And I'm like, Jack, what's going on? I can get kids to interact. I mean, I'm a nut. Kids love that. So I'm in his face. I'm trying to get him to interact. Nothing. I go to the chart. He was perfectly normal when I had seen him at 1. He was starting to have a couple words. At 18 months, he was perfectly fine. Now he was gone. I knew in my gut he had autism. He later ended up being formally diagnosed with severe autism. To this day, he barely speaks a word, and he's severely affected. He was the 4th case in 4 years in my personal practice. Now, at that time, I had a practice of about 2,000 patients. I was getting about 100 newborns a year. So that's 1 in 100. And this was just like, I'm thinking to myself, how can this be? I didn't see it in medical school. I rarely saw any severe, I saw no severe cases in residency, just a few mild cases of what we used to call PDD-NOS, pervasive developmental disorder not otherwise specified. That would be like an ASD, autism spectrum diagnosis today. But clearly, and the numbers have shown that the numbers just have gone through the roof. And you see the chart there, it was almost non-existent in the 70s. I think the rates at that time in the literature are 1 in 10,000. It's now, some of the latest studies from the CDC, 1 in 45 was one study last year. I mean, imagine that. It's just unconscionable. There was just an article published last month from California. They have seen a 7 times 600% increase in autism diagnosis in their public school system. 1 million kids with an autism diagnosis. They compared last year to this year, and there was a 7% increase in autism diagnosis, and in the kindergarten class, there was a 17% increase. So this rise that you're seeing on this graph continues. This is a health crisis of unimaginable proportions. We can no longer stick our head in the sand and say vaccines are safe and effective, period. Now, I don't want to give you the misconception that it's just vaccines. The first chapter in our book is toxins, toxins, toxins. I have 1 child in my practice, so I now have a practice of 13,000 children. And just to give you an idea, I recently ran the numbers. We have over 200 autistic children. We have over 800 with ADD and ADHD. We have over 400 with anxiety or depression. As you can see, our children's brains are suffering. But out of those 200 with autism, I do have 1 child who got no vaccines. They happen to have a family history of autism, which puts you at much higher risk. We know this. Now, I want to talk to you a little bit about aluminum. So we got the mercury out of the vaccines back, Jennifer was telling that story. That was exactly how it played out in my practice. I was so happy about getting the mercury out of the vaccines in 2001, because that was when it started being phased out. I remember going to my youngest child's 1st grade teacher saying, you know how you're seeing all this autism? You're not going to see it anymore. Just wait 5 years. I was like a boy in a candy store. I thought, we figured it out. Well, as you can see from the graph we just showed, and those of you who work with children know, we haven't figured it out. The autism rate continued to rise. Why? Well, I'm going to give you some clues, and our book shares this. It's toxins, 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 like the first chapter said. But the biggest one that we need to pay close attention to, or at least one of the most important ones, I think, is aluminum. So you've got on your screen there, Aluminum Toxicity in Infants' Health. This is an entire book. There are 3 entire books with hundreds of references on aluminum toxicity. The tragic thing we did is in 2001 to about 2003, we reintroduced the hepatitis B to the childhood vaccine schedule. We used to give that vaccine to teenagers, but in the early 2000s, that vaccine was moved by the AAP and the CDC to be given to infants. To this day, you're born, as Jennifer pointed out with her own child, happy birthday, here's your hepatitis B vaccine, your vitamin K shot, and your eye ointment. When parents sign in to have a baby in the United States in a hospital in this country, you are giving permission for routine care. And in almost every hospital that I know of, hepatitis B vaccine is part of the routine care. What's not understood or even known by a lot of pediatricians is that that vaccine has 250 micrograms of aluminum. Now you might say, well, that's not that much. There is a live document on the FDA website not to exceed 5 micrograms per kilogram per day. We have it in the back of our book, in case that gets taken down, we have that particular reference that's been up since 2000. There was a Bishop study in the New England Journal of Medicine in 1999 that showed the same thing. Kids who got more than 5 micrograms per kilogram per day showed decreases in their neurological development in a very well done study. So it makes absolutely no sense to give a 10-pound, 4 or 5 kilo baby 250 micrograms when they shouldn't be getting more than 20 to 25. We were at our book talk down in Ashland, and somebody asked, well, how much is a safe amount of aluminum? The answer is 0. But we do have those guidelines not to exceed 5 micrograms per kilogram. We know from lead, we know from neurotoxins that a little bit is bad, and there is really no safe level. We also know with toxins that 1 + 1 does not necessarily equal 2. There can be a multiplier effect. So unfortunately, there are several vaccines with aluminum, and so this is why this becomes problematic, just the same way that I think thimerosal, the Mercury, had been. As we added more and more vaccines to the schedule, compressed it down into infants who have smaller body weight, less ability to remove toxins, it's no wonder that the toxins in vaccines start becoming a problem. One of the things that we do know is that there are no large tests done by the CDC or by anyone comparing unvaccinated to completely vaccinated or partially vaccinated children. That needs to happen. I'd like to tell you about informed consent. I kind of mentioned it earlier, but Oregonians for Medical Freedom is one organization that Jennifer and I participated in from the beginning with the sole purpose of fighting mandated vaccines. In other words, we want informed consent. We want that the country as a whole to have the right to make a decision based on all the facts and all the information. So we're basically champions of medical freedom, and that freedom has to be that a parent is the one who's in the best position to make healthcare decisions for their children. This should not be something that's legislated by a state government, public health officials, or even your doctor, who unfortunately oftentimes are misinformed or uninformed about certain risks, take the aluminum example, or your specific family history. If we go just with strict CDC guidelines, you could have a autistic child and still not get an exemption for a subsequent child, which is absolute insanity. So one of the things I just want to say, in the book we outline sort of evidence-based protocol of some things you can do to reduce toxicity. And one of the big ones is no acetaminophen. So Tylenol, acetaminophen, blocks the ability to make glutathione, your major detox molecule. Think of it as the multiplier of toxicity. When I sit down with a prenatal visit for a new couple and they're expecting their first baby, and mom's usually, unfortunately, late in pregnancy and I'm getting to her too late, we need, before you even get pregnant, to be aware of toxins so you can minimize toxins. There's this body burden of toxins, and the uterus shunts nutrients and toxins. There's a little bit of filtering, but not a lot. So there's the first exposure is in the womb, and then you're born. We've got that hepatitis B. So the next main recommendation, besides no acetaminophen, period, get rid of it, get it out of your cupboards. I know the OBs say use acetaminophen, not ibuprofen, but that's got to stop. There was just a published study last week showing acetaminophen in pregnancy leading to ADD, ADHD. So the evidence is mounting. So no Hep B at birth unless birth mother has Hep B. The CDC data says 1 in 100 moms giving birth in the United States has Hep B. My own review of the literature makes it closer to 1 in 1,000. So in my practice, I've actually had not a single mom with Hep B. There has been no reason to give Hep B because we know mom's status. We also recommend, if you're going to vaccinate, that you only give one aluminum-containing vaccine at a time. In fact, it might be wise only to do one vaccine at a time, period. Breastfeeding is critical. So in countries like Scandinavia, where they have a much higher breastfeeding rate, they have a slower vaccine schedule, the outcomes for these kids there are so much better. There was a February 2013 JAMA article on Norwegian kids. 80,000 children followed for an average of over 6 years. Half the moms took folate, half the moms didn't. But their autism rate, which is what they were looking at, was 1 in 500 to 1 in 1,000. This was just 3 years ago, at the time when it was 1 in 100 here in our country. I looked at that article, I said, wow, here it is. Why are these kids in Norway doing so much better? We have 4 million births, almost 1 million cases of autism at the current rate we're going, I'm sorry, almost 100,000 a year at the rate we're going now in the US. And it would be 1/10 of that in Norway. They must be doing something right. Well, they don't give hepatitis B to newborns. They start their schedule later at 3 months, and it's a much slower vaccine schedule. They breastfeed. They don't have as many toxins in their environment because of GMO and such. So there are some things we can do here in this country that will make a huge difference to our chronic disease and reduce things like autism, and I suspect all the chronic diseases in children. Vitamin D is definitely an important vitamin. So if you eat your vegetables and you're eating lots and lots of organic fruits and vegetables, this is a very good thing for your nutrients, but it doesn't get you enough vitamin D. I recommend, if there's no other supplement you take, you should take vitamin D to get your levels up to a decent level. Normal is quoted in the literature as 30 to 100. I think optimal is 50 to 80, but at least get it above that 30 level, because in my practice, when I test people who are not taking a vitamin D supplement, nobody has an adequate level. Almost nobody. And there are just probably at least 100 studies showing the importance of that. So moms, before you get pregnant, while you're pregnant, get that additional vitamin D. I recommend 5,000 IUs a day for adults, even pregnant moms. And then it's just limiting your exposure to toxins. We talked about acetaminophen, but you've got to worry about pesticides and herbicides, eat organic, lead. There's even the air you breathe, the water you drink should be filtered. We need to stay away from toxins. Let's see. Jennifer, do you have any input at this stage?
No, I think I'm gonna, because people can only see the slides and can't see me, right? So I think I'm gonna take the slides off. There's just one more that I wanted to, if you see them, I just want to show the part of, I think, our message. This slide says pregnancy is a state of good health, not a disaster waiting to happen. And we've gotten to the point where we don't trust ourselves as parents, and we listen to our doctors and we listen to the people who are profiting off of us. And I just want to add that when you have a really healthy baby and a really healthy family, nobody really makes any money off of you. So what we are advocating goes against our medical system. And in a way, what we want to do is we want to put the vast majority, I don't know if I can say this, Paul, but we want to put the vast majority of doctors out of business. And Paul, I think it's, when I went to, now I don't know if you had staged this or not, but we live in the same state, but we live 5.5 hours away from each other. And Paul has a room in his office for well babies and a room, well children, and a room and a sick room in case he needs to have sick kids. So I walk into his office, there were 25 happy, healthy kids in the well waiting room. There was nobody in the sick room. And I thought, this is a snapshot of what we're hoping to do, is to have healthy kids who can grow up healthy and happy, not kids who are suffering from, so many different health problems that seem to be environmentally induced.
Well put.
So we have a question. Can you hear me?
Yes.
Okay. So we have a question from Lauren. Please address/discuss how parents can effectively argue with the doctors just after birth to advocate against these things. I hear this all the time, that, parents are being pushed, especially right after their baby's born. They're most vulnerable. They might have even had a birth plan where they've told the doctor ahead of time they do not want their child to get vaccinated. And I hear these stories that they go to the bathroom and then they find out that their child was vaccinated against their wishes. And, for me, I just find that incredulous that this is happening. But on the other hand, when my daughter was born 12.5 years ago, I was determined to breastfeed her, and I had the doctor again, walk in, 6 hours later, and I'm exhausted from, 18 hours of labor, to say my daughter wasn't breastfeeding enough and I need to give her formula. And, you know, I knew better, but how about all those parents that don't? So is there anything, any advice you can give for these parents so that they can advocate, you know, for themselves and their child and make sure that the doctors listen to them?
Well, when I do my prenatals, that is the most important message I drive home is mom and your partner, your support person, have to be real clear from the moment you sign the initial paperwork in the hospital, put a little star, no Hep B. When you hit the floor, you tell every nurse, you don't leave your baby alone, and you're firm. We are not doing the hepatitis B. Mom does not have it, so there's no risk to my baby. Period. You really don't have to argue. I mean, you could hand them our book if you want, but it's your decision, and they cannot force you. They think they can, but they cannot. So I would just stand firm, say this is something we're going to address with our pediatrician, but we're not having it done in the hospital.
I'd like to say something too to answer Lauren's question. There are several other ways to get around these problems, and they're very, it's really hard not to get bullied, and we all want to be, we all want to do what other people want us to do. We want to be good. We want to say yes. So saying no is really hard. But you know, you don't have to have your baby in the hospital. That first baby that I had in the hospital because my husband and I wrongly thought that that would be the safest and best place to have a baby. After I had wanted a home birth, he felt like it wasn't the right thing to do. After we both saw how we were treated in the hospital, we said, we're not doing that again. You know, we voted with our feet and we had 3 more children at home. When you're at home with a midwife who's practicing more evidence-based medicine than the obstetricians, and I have to say that because it's true, you're not going to be bullied into doing things that you don't want. And then the other thing is that if you're going to a doctor who's fighting with you, because it's very easy to just say, no, thank you. And what you say is you just say, we don't do that. And you don't talk about it, you don't argue about it, you just say, we don't do that. And then if they say, well, why not? You say, we don't do that. And that's the end of the conversation. You're in the driver's seat. But you don't need to go to the doctor and feel bullied and feel, you know, if you can't have a really open conversation. I mean, I will tell you, there's so many amazing, excellent, fantastic doctors in this country. And they're having good conversations with their patients. And they're saying, frankly, we didn't do that either. You know, so that's what's happening behind closed doors. Those doctors don't feel safe about coming forward and telling you who they are, but you can find those doctors. Go to a doctor who respects you. Go to a doctor who makes you on the team and understands that you are the point person for your child's health. And if you can't find that doctor, stop going to a traditional medical doctor and start going to a naturopath. Dr. Paul works with some incredible naturopaths, and I've found that some tend to have sort of a gentler, more symbiotic approach to our children's health, if I can say it that way.
Well, and I would add that obviously, Dr. Nancy, you're a chiropractor, right? And
I am.
And your background is very much more into holistic, and you know, I've been trained that medicine way, and come to find out that, you know, if you give the body the nutrients it needs and you avoid toxins, surprise, surprise, we could be healthy. As you said, Jennifer, we could put doctors out of business. The Academy of Pediatrics just came out with a ruling, or a practice guidelines, they call it, where it is okay to discharge patients who won't do all the vaccines. Well, I say to that, use your feet, like Jennifer said, and leave. There is no reason to go to doctors who are going to try to tell you they are the only authorities and they know what's best when they clearly do not. They apparently are not reading the literature. They're only following guidelines from the CDC, who clearly is conflicted. I know there are a lot of great people at the CDC. I happen to know a doctor who went there who's one of the brightest and best. But the committee that sits and makes the vaccine decisions, and they say, this is what one size fits all, this is what the country's going to do, that committee is conflicted. There have to be conflicts of interest, because there is no way on this earth that you could recommend hepatitis B for newborns who are born to mothers who don't have it. It defies all logic. Even a 3rd or 6th grade education can figure that one out, and yet they somehow can't.
I also want to just remind everybody who's listening that doctor means teacher. So if the medical profession actually started educating their patients about good nutrition and other lifestyle things they could do, they could be very busy keeping their population healthy. So it doesn't have to be just about vaccinations. And the well baby visit, of course, you write about in the book, Dr. Paul and Dr. Margulis, about, you know, what is the purpose of the well baby visit? I'm going to let either one of you answer that.
So you're absolutely right. It's about education. Sadly, I think pediatricians have sort of equated well child care with vaccine care. It's so much more than that, and it needs to be so much more than that. And what we do in our book is we actually take readers through each of those visits that they're going to be told to go to by a pediatrician and cover the topics that are most pertinent, the problems people are most likely to have, and we address the vaccine issue so that you can go in prepared to know what they're going to come at you with, because it's so difficult at the last minute. You're given this government vaccine information sheet that's all sterile. These are all the horrible diseases we're going to prevent, and vaccines are safe and effective. You know, they minimize side effects. So I think the book can provide readers with a tool of what to expect at those well baby visits. But you're absolutely right. It's about education, and that's what we need to be doing.
So as you know, because we were talking about this prior to the webinar today, my stance is a little different. I staunchly oppose vaccinations in the United States, and I do that because, you know, my personal belief and training, I've been a chiropractor for 23 years. I've also trained with a neuroimmunologist who talked about what happens to the immune system if you get injected during those first couple of years of life. It actually changes the way your immune system responds to foreign, you know, things, you know, bacterial and viral infections, that instead of going through the traditional way of being exposed through the air and breathing something in, and then going through, you know, primary, secondary, and tertiary immune response, your body actually learns to go directly into that immune response and may be the cause of autoimmune disorders. I was wondering if either one of you could address that thought.
I'd love to. So there's this new syndrome, relatively new, ASIA, autoimmune syndrome induced by adjuvants. There are now probably, I did a blog a couple years ago where I had 20 references, and there's many more since. Aluminum is the main adjuvant put in vaccines, and it is triggering autoimmunity. There are plenty of studies that show this. So is it any surprise that we're seeing more diabetes, that we're seeing more MS, that we're seeing all these autoimmune disorders, rheumatoid arthritis, celiac, you name it? The other thing you mentioned, though, is so important for people to realize. So we have all these vaccines, but they only cover a handful of infections. In life, we are exposed to tens of thousands of bacteria and viruses, and our body has an innate immune system to develop a symbiotic relationship. We have to be at peace with our environment. And when you inject toxins and these antigens, which are to just help you against that one disease, you're actually harming the natural immune system. We have studies that show that the more highly vaccinated you are, the sicker you are. So you actually have more other infections. So the studies for vaccines are always done on just one vaccine and that infection. And the study will say, oh, look, we have less pertussis or less rotavirus or less this. But they don't look at what happened to the patients with regards to other illnesses. So we do have some information in the back of the book. I did a study in my own practice. I got a institutional review board approval to look at my practice retrospectively. We had a group that was vaccinated according to the vaccine-friendly plan. Obviously, according to you, Dr. Nancy, that's way too many vaccines, and I see your point, right? So it is. I mean, no vaccines would be the least toxic approach. But that I get patients who are being pressured to do them all, and sometimes I can't get them not to do any, but I can get them to go slower and at least more carefully. And that's what this book tries to provide. But anyway, we had over 1,000 patients in that group of vaccinated in the Dr. Paul's vaccine-friendly plan. And we had no new autism out of over 1,000 kids. We had 238 unvaccinated children, no new autism or autism spectrum. And in the almost 900 kids who were more heavily vaccinated, we had 15 cases. So the statistical significance was huge, a 1 in 100,000 chance that that could happen by accident. The other interesting point, though, was the unvaccinated kids were by far the healthiest. So we looked at ER visits, vomiting, diarrhea, office visits for illness, hospitalizations, and across the board, the unvaccinated kids were the healthiest. And there are other studies that have shown this. And that speaks to what you're talking about. What does it take to be healthy? A healthy immune system. So how do you get a healthy immune system? You avoid toxins, you don't over-vaccinate, and you get your nutrients.
Yeah, well, I want to argue a little bit the other side. You know, I think that I think that vaccines are one medical tool in the toolbox, and I think that we have the luxury of living in a country where we have access to clean air and clean water and good nutrition if we choose to have good nutrition. But I don't want to downplay the importance of some of these infectious diseases. Now, some very interesting new science has been coming out showing that there may be benefits to getting diseases, but you know that actually can benefit your immune system and that can stave off autoimmune disorders. And right now, the urgent problem in the United States is the chronic disease and the autism. But that doesn't mean, I mean, it depends on your family's risks and it depends on what your exposures are going to be. You can't just say, don't vaccinate and keep eating the way that Americans eat and feed your children formula and never go outside so they're totally vitamin D deficient and don't do any exercise but stay in front of a screen 12 hours a day, because you are not going to have a healthy kid and you're not going to have a healthy immune system. So I think that if you choose to do no vaccines, that you have the responsibility of educating yourself and your children. And if you choose to do all the vaccines, you have this responsibility also to educate yourself about what it means to be healthy. And it's not easy. People think that you can only be healthy if you're rich, and it is very discouraging for a family on a budget to try to find organic food. But there's other things that you need to do. So, you know, there are ways to do that. You can grow your own food. You can make connections with farmers. You've got to let your kids go outside and play in the dirt. You've got to let your kids get in the sun. You've got to get your kids off of their screens. And I'm sorry if I sound very enthusiastic. It's just that it's not true that if you don't vaccinate, you're going to be healthy, or if that you do vaccinate, you're going to be healthy. That's too simplistic. And I think that that's why we wrote such a comprehensive book. It's 448 pages long because we had a lot to share about this stuff. And you know, another thing that we know benefits a child's immune system is skin to skin. So you got to love all over your baby. You got to hug them. You got to kiss them. You got to be with them. You got to cuddle. You got to read to them. I mean, all of this is part of the puzzle. We are walking organisms, walking, you know, complex ecosystems, and there's so many things that we can do, but you can't just sort of do one and say that's the magic bullet. And I do think some people who are very staunchly anti-vaccine, as you identified yourself, Dr. Nancy, you know, think that you take the vaccines out and all of a sudden, presto, everything will be fine. You won't have any more toxic exposures. Your kids will be healthy, and that's just not the case.
I agree. And, you know, in practice, I'm not currently practicing right now. I'm really focusing my time full time on educating people about how to get healthier as well. And, you know, I always advocate for clean food, you know, not eating things with these bright colors in it because we know that that's damaging. You know, getting all the things that you mentioned, I totally agree with, because health doesn't, I don't believe health comes in a pill or a bottle or a syringe. I believe it comes by making good choices in your life and also reducing stress. And I think that kids are inundated with stress these days. You know, both parents may be working, or they're having too much homework at school and they're being pushed academically way too early. There isn't one answer to raise a healthy child. There's a multitude of factors, and I totally agree with you. We do have a few questions here that I want to make sure that we cover. One was from Elizabeth about what kind of brand of oral vitamin K do you recommend?
That's a good question. I have only found one in the United States that is let's see. I should have the brand at the tip of my tongue. It's sitting on my desk, and I'm at home today. Do you
While you're thinking of that, can I tell a funny story
tell
about
a funny
vitamin
story?
K? So, you know, we could do a whole show on vitamin K. And vitamin K is a shot that's given along with the hepatitis B vaccine to newborns because newborns are born vitamin K deficient. That's what we say. And for about a year and a half, Dr. Paul and I have been discussing, sometimes a little bit heatedly, the question about vitamin K, because there's a new standard of care on the West Coast to give oral vitamin K, and there are several big studies that show that it looks like oral vitamin K is as effective as at preventing brain bleeds. And the issue is that people don't know this, but at least one of the brands of the vitamin K shot that we give to newborns also contains aluminum. Now, Dr. Paul has been recommending vitamin K shot, and he did not want to believe me. I had to show him the cold hard evidence. So we've been trying to find, it's harder to get oral vitamin K, but I think that is the new recommendation of several of the most educated, evidence-based West Coast pediatricians. Correct me if I'm wrong, Dr. Paul.
Well, there's a handful of us who are setting the standard, let's put it that way. Most unfortunately, a lot of hospitals are using vitamin K preparations that have a lot of toxins in them. The least toxic one I've been able to find still has a large dose of polysorbate 80, which it's an emulsifier put, I think, just to keep it in solution, but when you inject an emulsifier, there are studies showing it affects the gut barrier, so it's actually harming your gut permeability, and it's probably not good. So, you know, in medicine, we have a lot of things that go back, you know, a century ago that we just take on face value, and I think vitamin K switching to oral is a reasonable option. There are conflicting studies, of course, which is better, but I think you should do something. I want to say that BioK is the brand, but that's not the manufacturer of the one that I recommend. Dr. Paul Approved is my website, and I'll make sure I put something up there for people who need that answer.
So we're running out of time, so I have another question from Lauren. She wants to know what you think about an adult born in the early 70s and had much less vaccines, who had to have the MMR at age 20 for college, and what connection might there be between that and immune system and autoimmune system disorders?
Yeah, the MMR is one of my least favorite vaccines for the mischief it seems to cause for a lot of people. So many of my autistic families give the story that it was after the MMR that their child regressed. It's 3 live viruses and a lot of toxins and contaminants, what have you. That vaccine, however, gives a very high titer that is very long-lasting. There is this misconception in some of the literature that you need a booster. I've done the study. I've actually measured titers. I have almost 1,000 titers I've measured in my patients, and 95% of them have very high titers against measles, mumps, and rubella. Sometimes not the mumps. The mumps part is problematic, but measles and rubella, the main two really, this person going to college could have had their blood drawn and proven that they don't need a booster. So that would be my approach. Get your titers drawn. They're probably fine.
So someone, Nicole asked, should parents with autoimmune diseases vaccinate their children? And I know that a lot of these vaccines shed. So that, and I know if you go to the many hospitals will tell you if you've been recently vaccinated to not go near anyone who's in right, you know, in a serious condition.
The live virus vaccines, which is your MMR and your chickenpox, and rotavirus is oral live virus. Those ones do shed, and so you're absolutely right. And as far as if you have a strong family history of autoimmunity, just like if you have a strong family history of autism, you shouldn't vaccinate. That's my opinion. That's not what the CDC says. The CDC says don't worry about it, but it is clearly a high risk factor for having triggering problems if you vaccinate when you have those family histories.
I have one last question for you. I think it must have taken a lot for you to come out of the closet and to really go against what the common knowledge is, or the common information that's being shared by the CDC and many of your peers. What gave you the courage to do this?
Well, you know, like when I told Jack's story, that really was the last straw. When you start to realize that, here's the thing, when you know better, you should do better. And as I started to do my own independent research, I just knew too much. I had learned too much about the toxicity of thimerosal, of aluminum, and vaccines in general triggering autoimmunity. And then when you learn about Asia, autoimmune syndrome induced by adjuvants, the information is starting to become overwhelming. And then when I saw it in my own practice, I could not ethically continue to cause harm. You know, we're supposed to say first do no harm. And clearly I was part of the system that was causing harm. And I just couldn't do it anymore. So I went to my partners in November of 2007 after Jack's story, and I said, I can no longer ethically give the hepatitis B vaccine. And within a month, they had basically shown me the door. They said, if you don't do all of them, that's not ethical because that's standard of care. And I just, you know, I was raised to challenge authority if authority's wrong. I mean, you don't, if you're silent in the face of something that's wrong, then you're complicit, you're a part of it. And I just wasn't raised that way. I give that credit to my parents. Now, of course, with integrative pediatrics and a huge experience, I have no doubt we're on the right track. And the evidence is mounting while the system is trying to suppress it. The other thing, just in practical terms, there is a danger as a standard pediatrician to sticking your neck out like this. And I'm old enough, and my kids are now, my youngest is in college, that, you know, whatever, right? It's like, I think it's very difficult when you're young, you know, doctors who have a young family to support, to put their career at risk. It's a challenge. In medicine today, if you're a pediatrician, we are judged by quality measures, and one of the chief quality measures is how well you vaccinate. So, and it's all or none when they look at it. So in my practice or in my town, I have no doubt I'm the worst pediatrician, because my vaccination rate is close to zero, not because I'm not vaccinating. I am vaccinating every day in my office, but I don't do the hepatitis B for people who don't need it. So guess what my hepatitis B rate is? 0.5%. That's a patient who joined my practice having already gotten it. I discourage it. It's a mistake. So therefore, I'm a bad doctor. And this is the pressure doctors are under. Some of the insurance companies are actually having financial incentives for quality measures. So therefore, you're actually going to take a huge financial hit if you don't do all the vaccines. Not to mention, pediatricians will argue about this, but there is reimbursement for vaccines. There's an administration fee, and I've done the math. In my practice alone since 2008, I've lost over $1 million in administration fees alone. That's a lot of money. That means that my employees actually have to sacrifice. I can't give top wages because the income isn't there. So it's actually a survival thing for many practices as well.
Jennifer, Dr. Margulis, why don't you tell us a little bit also about the other book that you've written?
The book that I wrote before this one, which came out in paperback in 2015, is called Your Baby, Your Way, Taking Charge of Your Pregnancy, Childbirth, and Parenting Decisions for a Happier, Healthier Family. And it's basically a follow the money. I mean, it's a lot of what we talk about in this book, but from the point of view of an investigative journalist.
I could make a little plug for you, Jennifer. I just saw an article yesterday that I posted on Facebook where if you get ultrasounds in the early trimesters, it's actually linked to increased severity of autism. And I know you have a lot of studies in your book that speak to the problem with ultrasounds, and yet I sit on a committee that credentials physicians, and I was asking the OBGYN in that office, says, how often are you doing ultrasounds? Oh, we do them every visit. It's just like a routine thing. Come on in, let's see how your baby's doing. And there's a lot of problems with it that you outline very nicely in that book.
Yeah, it's funny because I think, Dr. Paul, you posted it, an article today, and then Dr. Margulis, she took your post and reposted on her page, and then I posted on healthy alternatives to vaccinations. And that's, you know, I would love to do more of these because I think we could do a whole one just on pregnancy. We could do a whole one just on, the first few months of life. There's so much important information. We all have a little different perspective, and I'm grateful for both of you coming on today, and I really want to recommend everybody who is thinking about having a baby or just had a baby to get this book, because I've gone through most of it, and there's a lot of great lots of great information. Lots of great information. Yes, there's a lot of information on vaccinations, which I don't agree with all of it, but that's okay. There's a lot of great information about nutrition and the other things that are really essential to have a healthy child, and I'm really grateful for you.
Thank you, Nancy. A couple things I don't think we stressed on. No vaccines if you're pregnant. There's just no good evidence that that's safe. And if you have any developmental issues, either they're happening or they start happening, you stop vaccinating. That's if you are vaccinating. You don't want to keep triggering further problems if your child's starting to give you a sign that there's an issue. So if you are going to vaccinate, go slow, and if you start to see problems, stop.
Perfect. Any last words, Dr. Margulis?
No, but I actually have to run, but thank you so much for having us.
Thanks for having us on.
And thank you all for joining us.